Hi, and welcome to the Gut Rehabilitation Seminar. I'm Dr. Eric Balcavage, and in this video we're going to talk about the inflammatory bowel disorders and what I do in my practice to help people recover from these devastating conditions. I've been in private practice for 15 years, the last 5 years of which I've been focused primarily on chronic conditions like irritable bowel disorder, Crohn's disease, celiac disease, fibromyalgia, migraine headaches, peripheral neuropathy. And one common theme as I take care of all people with chronic conditions is most of them have some underlying gut problem. So over the last 5 to 6 years, I've spent and invested a lot of time in getting to understand what's creating these chronic problems. So now I consider myself an expert on helping people with chronic bowel disorders. So a couple things that you should probably write down as you watch this video. The first of all is that most of the advice that you've been given regarding your GI problems is probably wrong. The reason most of you have GI problems is because you're unhealthy. What most doctors will tell you is the symptoms you have are the result of the chronic condition. You have the symptoms you have because you have colitis or because you have irritable bowel, and that just isn't the case. You were unhealthy first, which led to your symptoms, which led to a diagnosis of whatever condition you have. So your poor health has created the diagnosis you have. So what we want to focus on is not on treating your symptoms or your condition, but on treating what you and what's causing you to be unhealthy. You must address the underlying cause of the condition if you hope to not have to take medications and treatments for the symptoms year after year after year, and as you watch your health continue to decline. You're going to need a doctor, though, to help you find the underlying cause, and that's just not helping if you've come to this site and you're watching this video, you're struggling with this condition. Let me tell you, I am that doctor who's going to help you find the underlying cause and help you get your life back. So let's talk about the inflammatory bowel disorders. It doesn't really matter what the diagnosis is, whether it's inflammatory bowel disease, Crohn's, colitis, heartburn. All these chronic GI problems have two common threads. One is that there's chronic inflammation and there's autoimmunity. And that means your immune system has decided to start to attack your own intestinal tissue. So if you have colitis, then we have autoimmune attack against the colon. If you have celiac disease, you have autoimmune attack against the intestinal lining. But there's common themes: inflammation, autoimmunity. What we need to do when we have these chronic conditions is we have to try and identify what is causing the chronic inflammation and the autoimmunity. An interesting thing is that if you have one autoimmune condition, and you do if you have colitis or Crohn's or diverticulitis, what you're likely to develop, and maybe already have, another underlying autoimmune condition. Things like rheumatoid arthritis, Sjogren's disease, Hashimoto's thyroiditis, which is the most common cause of, or the most common autoimmune condition in the United States, affecting probably 1 out of every 8 women. So if you have any of these other autoimmune conditions, then the likelihood is that what you're experiencing, if you haven't been diagnosed yet with gut symptoms, that you probably have an autoimmune condition in your gut. Couple of quick definitions. Inflammation is a protective tissue response to injury or destruction of tissues, which serves to destroy, dilute, or wall off the invading organism or whatever the problem is. So that's a normal, healthy response by the body when it's a short-term response. Autoimmunity simply means that your own body's immune system is attacking your own tissues. So let's talk about the current medical paradigm with dealing with inflammatory bowel disorders. What happens is once you're identified or diagnosed with an inflammatory bowel disorder, there's two problems. One, your diagnosis is treated or your symptoms are treated. And what happens is you get anti-inflammatory medications. So your doctor says, hey, this is an inflammatory condition. We're going to give you some medications to decrease your inflammation. And for some people that may work in the short run, but for most, it only works for a short period of time. If they go off the medications, the symptoms come back, or they stay on the medications, they don't work and they have to change. What we haven't addressed is what the underlying cause is. For others who have been diagnosed with an autoimmune condition, that's great. Doctor diagnosed you with the autoimmune condition and then says, you know what, we're going to give you some autoimmune drugs or some immune suppressive drugs so that we can suppress the immune system's response and stop or slow down the attack on our own tissues. The problem with that is it suppresses the whole immune system, which makes us more susceptible to other disease or other illnesses. And when the condition really gets bad, if the anti-inflammatories aren't working or the immune drugs aren't working, then surgery is usually the next and maybe the most progressive step or the most aggressive step where they take out the damaged tissue. The big problems with this model, though, it may only provide temporary relief. The side effects of the treatment sometimes are just as bad as the symptoms you experienced before you had the treatment. It never addresses the underlying cause. So the question we should be asking our doctor when we have an inflammatory bowel disorder is, what's causing the chronic inflammation? If I have an autoimmune disorder, what's causing my autoimmune disorder? And this model just doesn't treat it. And this model really isn't basing their treatment on the most recent research. What we're finding now is that most doctors or treatment protocols are about 10 to 13 years behind the research. So the treatment you're getting now is about 13 years old. It's not based on the most cutting edge research. So the last problem with this model is that treatment is disease or diagnosis focused, not patient focused. And what that means is, if you have a symptom, you go into your doctor and you say, hey, listen, I have reflux. Your doctor's going to give you a medication that's designed for reflux. And they work, at least temporarily. And he's doing what his job is. The problem is he's not addressing the underlying cause. So you're either stuck taking that reflux medication for the rest of your life, or you stop taking it and the symptoms come back. We've never really fixed the underlying problem. When somebody's diagnosed with celiac disease, the treatment's the same. If somebody is diagnosed with colitis, the treatment's the same. It's the same medication, same treatment. But we should be asking, what's causing each individual patient's colitis, celiac disease? Because the causes of everybody's individual condition could be different. But instead, in the medical paradigm, we put everybody in a box and we treat the box. That just doesn't work. If it did, you wouldn't be coming to this site. So what makes my program different? My program is definitely patient-focused. I really don't care what your diagnosis is. I mean, I'm interested in what somebody's diagnosed you with, but what I really care about is what's causing you to have your symptoms, what's caused you to be labeled with the diagnosis you have. The focus has to be on identifying the cause. I use the most cutting-edge tests. So I'm not using the tests that are 10 or 13 years old. I'm using the most cutting-edge tests and the best available tests. I really don't care what an insurance model tells us. We're going to use the best available test, because if that's what's the best, that's what we want to use. The other thing that's important about our care is that once we identify the cause, we want to remove it and allow the body to heal. There's no drugs and there's no harmful side effects with the treatment we use. This program is not for everybody. You must be willing to change something in your current diet, your lifestyle, your behavior patterns. Something in your current lifestyle has created the problems you currently have. So something's got to change. So if you're not willing to change your current habits, it's going to be hard for us to help you. The other thing is you have to take personal responsibility. You have to be willing to be responsible for your own health care. It's nobody else's responsibility except yours to get yourself better. You only have one trip around this big planet. And I guarantee you don't want to spend the next 5, 10, 15, 20 years feeling like you currently do. Because if you don't change something, it's not going to get better. It's only going to get worse with time. All right, so let's talk about the gut. So the intestinal lining is like the screens in your house. The screens on your house have small holes. They're big enough to let air through, but small enough not to allow the bugs, the moths, the critters, the insects in. The intestinal lining is the same way. It's got small little holes to allow digested food particles to work their way through the intestinal lining, but to keep out the undigested food, the bacteria, the parasites, the yeast, and anything that shouldn't get across that barrier. Problems occur when that barrier gets damaged. So, just like if I came up and punched a couple holes in the screen door of your house, what would happen? The bugs, the moths, the flies, the critters would get in and create chaos inside the home. The intestinal lining is the same way. If that intestinal lining becomes damaged, undigested food, bacteria, parasites, toxins, and waste can work their way through the intestinal lining and create problems inside the body. The intestinal lining contains 70 to 80% of the immune system. So when undigested particles get across that barrier, that stimulates an immune response, and that immune response stimulates inflammation. So if the gut barrier is damaged, we have chronic immune response. Immune response drives inflammation, and it's the chronic inflammatory response that drives autoimmunity. When there's inflammation for extended periods of time, the immune system can get confused and start to attack and damage our own tissues, and that's what we call an autoimmune condition. So if we take a look at the gut barrier, there's two ways that the intestinal barrier can become what we call permeable or leaky. The damage can go through the individual cell itself, or the junctions between the cells can become damaged and compromised. And that's where the leakiness or the permeability can occur. When we talk about the gut barrier being damaged, we call it intestinal permeability. And the intestinal lining is one cell layer thick. And so you can see on the slide that you can see the individual intestinal cells. There's two ways that the intestinal lining becomes permeable. The damage can occur through the individual cell itself, or the damage can occur between the cells. It can occur either one of those or both at the same time. When that occurs, that's what we call intestinal barrier permeability, and that's when undigested proteins, foods, bacteria can leak through, stimulate the immune response, and cause the chronic inflammation. And this is going to occur before you develop celiac, Crohn's, colitis, diverticulitis. This is where the breakdown occurs first. Once this occurs, the immune system starts upregulating, and that stimulates the inflammatory response. And those things have to happen first. Testing this intestinal barrier is critical to finding problems before they develop into an actual pathology like Crohn's or celiac. There are multiple factors that can cause breakdown of the intestinal lining, whether it be food intolerances, whether it be bacteria, whether it be parasites, whether it be yeast, medications, stress response, abnormal digestion of enzymes. Lots of factors can cause that barrier to break down. Part of what my job is to help you identify what's breaking that barrier down, if it's broken down, and what's breaking that barrier down. The best available test right now is from a test from Cyrex Labs. It's called an intestinal permeability test, and it'll tell us exactly how that barrier is broken down so that we know exactly how to treat it and correct it. So how do I go about identifying the causes of inflammatory bowel disorders like those that you're suffering with? What I do different is I run a series of different tests. Most of you have already been to your primary care or to a specialist. You had a metabolic panel done, maybe a CBC panel done, lipids, maybe you've had a scope or a biopsy. Now I'll do those same initial tests. I don't do scopes, I don't do biopsies, but we take a look at those initial tests. But we go further than what's traditionally done. We do a whole bunch of other tests to help us identify what's going on with that intestinal barrier. So some of you may be listening to this video and saying, yeah, but I went to my doctor and all my labs are normal. Well, if your doctor told you your labs are normal, there's probably two reasons for that. One, he's not running the right test. And two, they're using traditional lab ranges. Traditional lab ranges are great for identifying pathology once disease is already present, but they're not really helpful for identifying the underlying cause or developing the early signs of a problem. So we use a different range, and that range is called the functional range. So if you look at this slide, in traditional medicine we use lab ranges, and they're pass or fail. You're either really healthy or you're really sick. And so the normal range is really wide, as you can see by the green bar. If you're in that green bar, you're as healthy as 97% of the population. And if you're in the red, then you're in the sickest 3% of the population. So these ranges are really broad, and they're not really, like I said, they're not really good for helping us identifying early problems. I use a different range, which was developed by the Clinical Chemists Association, and that is called a functional range. And if you think about grades in school, the functional range is the A range, the red range or the abnormal or the lab range is the F range, and the range in between the green and the red, that yellow range you see on the slide, is like the B, the C, or the D range. The closer you are to the red, the sicker you are becoming. We want you as close to, if not in the green range, in all your lab ranges. Your doctor is not using this lab range, so it's hard for him to find when you're starting to develop problems. He's only really picking things up when you already have the disease and pathology. So we'll use the lab ranges. So whether you think your labs are normal or not, I'm going to want to see what those lab ranges are. So let me give you an example of how lab ranges differ from functional ranges. If you look at this slide, we can look at something like glucose or TSH or cholesterol levels. Most of us are familiar with cholesterol levels, and we know that a cholesterol level greater than 200 is a bad thing, but anything lower than 200 is great. Unfortunately, that's not the case. Cholesterol is an important molecule for every cell membrane. It's part of all the hormones you make and neurotransmitters. So it's really important that we keep people within a functional range, not just really low. So the functional range for cholesterol levels is 150 to 200. a lab range of 148, your doctor might be thrilled, but I would be unhappy with that because I know that you probably have too low of cholesterol, and that's going to compromise cell physiology, it's going to compromise hormone function, it's going to compromise neurotransmitter function. So the functional range is a much better range to measure someone's health. The lab range is good to measure disease, but we're trying to get you healthy, not manage your disease condition. So what else do I do? The most common autoimmune condition in the United States is Hashimoto's. So while you may not have been diagnosed with an autoimmune condition yet, I typically run a thyroid panel because thyroid hormone is critically important for GI function, and we'll run thyroid antibodies because it's the most common autoimmune condition, and if you have one autoimmune condition, the likelihood is you're going to have another one. So your GI problems may be an underlying autoimmune condition, so we want to identify that. We'll do a vitamin D panel because vitamin D is critical for the health of the intestinal tract, as well as a very important hormone for the immune system. We'll do the intestinal permeability test I talked about before from Cyrex Labs. We'll do immune panels. We'll do an adrenal stress index, which measures your cortisol levels, because cortisol is a hormone that's increased with chronic inflammation. So we need to know what your cortisol levels are so we can help you support that system. We'll take a look at hormone levels because hormones are critically important for GI function. We'll look at food sensitivity panels because foods, you can become food intolerant to foods, which can cause destruction of the GI tract. Matter of fact, the most problematic food, one that it is currently thought that 1 out of every 3 people is gluten intolerant. And I can tell you from doing lots of intestinal permeability tests and lots of gluten intolerance testing over the years, that by far, probably 90% of the people that come in here with GI complaints are gluten intolerant. Now you may have said, but I already had a gluten intolerance test done and it was normal. The test that you get at LabCorp or Quest is not adequate enough to identify the underlying causes or to really identify if you're truly gluten intolerant. It tests one of about 12 markers that are breakdown products of gluten that somebody can be positive for. So it's a very antiquated and inaccurate test, okay? Even people with celiac disease who we know have a gluten intolerance only test positive to the 33 gliadin myrrh, the component that's tested at Quest and LabCorp, 40% of the time. So if people who are definitely gluten intolerant are only reactive to that one component 40% of the time, how valid a test can it be? So what other foods do we test for? We test for eggs, soy, yeast, and dairy. Those are the big problematic foods. We look at stool ecology profile because your intestinal tract can be damaged by bacterial overgrowth, yeast overgrowth, or even parasites. And you may have low levels of good bacteria, which can also lead to problems in the GI tract. So we need to do a good quality stool ecology test. And lastly, we do a functional neurologic exam because your brain controls function of every tissue and cell in your body. Your brain drives GI function. And there's a distinct tie between your brain and your gut function. Your gut is actually called the second brain. And 70 to 80% of your immune system lies in the GI tract. Those immune cells of the GI tract communicate with the immune cells of the brain. And so if the gut's inflamed, the brain's inflamed. If the brain's inflamed, the gut's inflamed. And so if either one of those two systems is not functioning appropriately, it can drive the chronic inflammation, it can drive autoimmunity. So we have to check neurology along with gut function and along with metabolic function. How do you know if you have poor brain function? Well, think about symptoms like this: declining memory, difficult to remember names, places, addresses, decreased ability to stay focused or to pay attention, harder to learn, we get moody and irritable easily, we're depressed, we have anxiety, we have fatigue when we're driving or when we're reading a book, especially like at night. You sit down to read a book and you just can't keep your eyes open. That's a sign of brain fog or brain fatigue and brain inflammation. So the important thing is that we have to look at the body both neurologically and metabolically when somebody's sick. That's the only way the body heals. So let me give you a summary of my program. First thing we want to do is we got to run some tests. Once we run some tests and so we can identify what's going on, I put somebody immediately on what we call an autoimmune diet. So we want to remove all the restrictive or all the potentially inflammatory foods from somebody's diet so we can start to allow the body to heal. Once the tests are back, we review those tests and modify a rehab or gut rehabilitation protocol so that we know what to do so we can remove the inflammatory agents, we can repair the damage to the GI tract, we can replace good bacteria so the gut has a stable environment, and then we retest the tests that were positive so we know we actually fixed what we set out to fix. Once that's all accomplished, we can reintroduce foods into the diet as long as they're not foods they're intolerant to, and the person can have their health restored and return to pretty much normal life. Years of chronic GI disorder and distress, years of feeling lousy, go away, and you can almost be back to a perfectly normal life. So Winston Churchill said, the price of greatness is responsibility. You've got to be responsible for your health. And to be responsible for your health and make something change, I want to help you, but you have to be willing to call the office, come in for an appointment. You got to be willing to let me do the tests. I'm going to identify what's wrong so we know what to fix. Then you got to be willing to make some of the changes and sacrifice. You got to be willing to change your diet and your lifestyle, and you got to be willing to follow my advice. If you do those things, we're going to change the quality of your health. We're going to change the quality of your life. You're going to get your life back, and years of chronic digestive disorders are going to go away. So if you're ready to change, I'm ready to help. And here's what we need to do. I need you to call the office and schedule an appointment. We call this a discovery visit. The first of those two visits is you're going to come in with all your paperwork. We're going to do a question and answer period. We're going to ask you all about what's going on, what your struggles are, what your symptoms are, what your challenges are, how this is affecting your life, and what your goals are. I'm going to do a functional neurologic exam on that visit. And then you're going to leave. You're going to leave me with all your paperwork, and I'm going to assess the exams, your paperwork, your history, your lab work. And you're going to report back to me on a follow-up visit where I'm going to explain to you what I see is wrong, what I'm going to do to help you, what tests we need to run, what dietary protocol we need to follow, what supplements you're probably going to need to take, and what those costs are going to be. So if what I've talked to you about tonight resonates with you, if you understand what I'm saying, if you're frustrated with the medical paradigm and the rat race you've been following, then pick up the phone. Call my office and schedule your 2 discovery visits so we can help you restore and improve the quality of your life and your health. Thanks.